Welcome to today's webinar, Strategies for Home Management of Speech, Swallowing, and Cognitive Deficits. I'm Lori Sjogren, Community Program and Services Director for the National Ataxia Foundation, and I'll be assisting with today's webinar, along with our Communications Manager, Stephanie Lucas. Questions for our webinar speaker can be typed in the Questions tab found in your control panel, and we'll do our very best to answer as many questions regarding this topic as time allows during our time together today. It's such a joy having today's speaker. Amanda Gallagher is a speech-language pathologist with the Johns Hopkins Outpatient Brain and Stroke Rehabilitation Program and Johns Hopkins Ataxia Center. Welcome, Amanda.
Thank you. Nice to be here. So I appreciate the opportunity to be able to talk with everyone today. I don't have any other disclaimers or conflict of interests. We are going to be talking about some exercises and some products that are suggestions for folks. Just wanted to let you know that I don't work for any of the companies mentioned. And certainly, as Lori mentioned, if you have any questions along the way, please go ahead and type those in the chat and we'll do our best. As a speech therapist, I'm a chatty lady, and I'm going to do my best to wrap up with enough time to get to all of your questions. Okay. All right. So let's start by talking about what it is that a speech-language pathologist does, like myself. So we diagnose and treat several different areas: motor skills for clear speech and clear sounds, swallowing deficits, cognitive issues, language issues, and one specialty of the field of speech pathology is voice. We're not going to be talking about voice today. I myself am not a voice expert, but it is one of the fields that speech pathology covers. So just a little bit about SLP services during the COVID-19 pandemic. Right now, many outpatient clinics are offering telehealth rehab. We received a question prior to today asking whether or not Medicare covers specifically swallowing therapy. So telehealth services are covered by many insurances, including Medicare. However, each insurance is a little bit different. So Medicare specifically right now is not covering dysphagia swallowing therapy and is not covering cognitive therapy by telehealth. Now that is quite literally changing. I mean, at one point, maybe 2 weeks ago, it was almost changing daily what the rules were. So I encourage you that if you have an interest, particularly after today's presentation, in reaching out to talk with a speech pathologist, to reach out to a local outpatient clinic and ask them, based on your insurance, what services are and are not covered. And they will have someone on staff whose job it is to be able to research that for you to help you make the decision of whether or not you want to schedule an appointment. If you are going the telehealth route, it does require access to a device with a camera. In my experience so far, you can certainly use a smartphone or a tablet. It depends on which platform the provider is using. So our platform in particular, we found that either a tablet or a laptop or a personal computer that has a camera is more effective than a cell phone, because with a cell phone, we're not able to share our screen. And so sometimes doing some of the exercises can become a bit tricky. And just overall, I'm going to try not to say this with each section of the presentation, but if you have not yet been evaluated by a speech pathologist and you have concerns in any of the areas that we're about to talk about today, the information I'm giving you today is, in these current times with difficulty accessing services, I'm just trying to give a very brief overview of some things that you can do at home to tackle some of these difficulties you might be having. It is not an exhaustive list, and this is by no means a prescription that all of these exercises do not work for everybody the same way across the board. So if you haven't met with a speech pathologist yet, I would encourage you to do so if you have any concerns in these areas. Okay, so let's start by talking a bit about communication skills. So Dysarthria is the medical term for a speech disorder that's caused by either weakness or discoordination of the muscles that we use for talking. So that includes our mouth, it includes our larynx, which is the medical term for the voice box. It also includes our respiratory system and how we coordinate our breathing with our speaking. For individuals with ataxia, there is a type of dysarthria called ataxic dysarthria, and probably not surprisingly, it's characterized mostly by difficulty with controlling and maintaining the coordination of talking. So it can lead to inconsistent errors of speech sounds. So you may say one sound and it's perfectly clear in one word, and then the next word it's not. May have difficulty controlling or maintaining speaking volume. Some people get very quiet, some people get a little louder, and some people have difficulty being able to maintain a steady volume. So they might have kind of short bursts where they're louder. They may notice kind of a harsh sound to their voice, more of a scratchy sound than clear, and may have some difficulty controlling breathing while talking. I think probably the biggest complaint that I've heard people tell me is, I just feel like I'm out of breath in a regular conversation. I just feel like I kind of can't keep up with my breathing when I'm talking. We do have some evidence now that a common symptom, dysarthria is a common symptom across many of the variants of spinocerebellar ataxia, and dysarthria can range from mild to severe, and the impact can be different for everyone. And what I mean by that is there are some people for whom they have severe difficulty pronouncing sounds clearly, but it is not, because they have strategies that may be effective and they've found other ways to manage. It doesn't seem to have a huge impact on their day-to-day. And then there are other people who may have a relatively mild dysarthria, but it has a huge impact on their day-to-day. So everybody is very different. This article gave a brief summary of some of the more common types of SCA and what type of speech changes might be seen because of it. So I believe that you'll have access to all of these slides after the talk today. But as you can see, for example, individuals with SCA1, you will likely notice more changes in the quality of the voice versus the changes in how articulation is, how clear the sounds are coming out. That's not to say that both can't be impacted, but usually voice more than articulation. And then as you can see, each of the different variants may present a little bit differently. So what are some exercises that can be done at home to help with clear speech? The first exercise that I've put up here is to target breathing and breath support. This is sustained voicing. So it is quite literally taking a nice full breath and holding ah for as long as you can. Comfortable pitch, comfortable volume, nothing fancy. And you want to time yourself, and the goal is to be at about 15 seconds or more. 15 to 20 seconds for an adult is on average is considered the normal limits. Now, if you try this and right now you average about 6 seconds, then you want to set a goal for yourself that you'll do this exercise every single day, at least 10 repetitions, more if you can, and that by next week you'd like to be up to an average of 8 seconds. And then once 8 seconds is easier, then you bump your goal up to being 10 seconds and so on. Some things to be aware of. Anytime you're working on breathing, if you get lightheaded, you need to stop the exercise and take a break. You do not want to hyperventilate and pass out. And certainly you also want to stop anytime you're doing any exercise for any part of the body, but any exercise that involves your voice. If it hurts, if it causes pain, then you want to stop. The muscles aren't moving the way that we want them to, and forcing them to do so won't help and can in fact damage the muscles. So if you sound strained or hoarse, then you want to stop and take a rest. It's okay to try it again later, and as long as your voice is relatively clear while you're doing it and or doesn't give you pain, then it's a good exercise to do. And then I'm not going to go through each of these because they are spelled out on the slide, but this is a variety of exercises that you can do for your lips and for your tongue in order to strengthen and coordinate. Most of the time for ataxic dysarthria, coordination is the issue, and it's not so much an issue of strength. However, over time, strength can become an issue. So if you feel like you have some weakness in your tongue muscles, if you feel like you have some weakness in the muscles of your lips and your face, then these exercises might be a good option for you. The general recommendation is to do 3 sets of 10 of these every single day. You can break them up throughout the day. You can certainly do more if you like. And if you have any questions afterward about demonstrating any of those, if they don't make sense, just let me know in the chat, okay? So strategies are probably the more helpful place to focus when you're working on clear speech with dysarthria and ataxia. So there is something called the SLOP technique, which sums it up very nicely. You want to practice reading out loud and using this SLOP technique to practice going slowly, being loud, and that doesn't mean that you have to be screaming, but up your speaking volume more than you would, higher than you would typically be talking, or louder. Over-articulate, over-pronounce the sounds. So for example, instead of saying the word stop, you would say stop, and really over-articulate that P sound, for example. And then the pause is a helpful reminder that we often think about within each word really focusing on the sounds, but then we can string words together pretty quickly, and we don't give the muscles a chance to take a break in between each word and reset and get ready for the next word. So if you're reading out loud, you want to pause for 2 seconds, let's say 2 to 3 seconds between each word that you're reading while you're practicing. That doesn't mean you need to do that in conversation, but if you don't practice nice and slow and over-exaggerated, then it doesn't tend to carry over into conversation very well. So really overdo it, overemphasize these strategies when you're reading out loud. You want to start with 1-syllable words, and you can just Google list of 1-syllable words and a bunch of them will pop up. It doesn't matter what the words are, it really doesn't. Start with 1-syllable words, going slowly, being loud, over-pronouncing the sounds, pausing between the words. And when you feel like you have that list that you're working on pretty well mastered and it's feeling pretty easy, then go to 2-syllable words. And then after that, go to 3-syllable words. And after that, you can go on to sentences or reading, reading the junk mail out loud, reading a newspaper article out loud. Tongue twisters are the most challenging thing to read out loud because they are specifically written to mess us up, right? So they're a really good way of practicing how to take our time and use strategies to not make mistakes in the tongue twister. And I've included a link to something called the tongue twister database, which has a ton of tongue twisters that you can read out loud. And that's, I use that quite often in therapy, that specific list. Okay, language skills. So motor speech is how the muscles are moving to make sounds when we're talking so that words come out clearly. Language skills are how we are thinking of the words that we want to use and how we're generating sentences and using grammar, etc. So there are 4 different domains of language. There's verbal expression, so talking, auditory comprehension, understanding what we hear. Reading comprehension is understanding what we read. And then written expression. Generally speaking, if we have difficulty thinking of the words that we want to use when we're talking, we will likely have difficulty thinking of the words that we want to use when we're writing as well. Spelling can be impacted, etc. Word finding is something that is kind of commonly reported in ataxia, as well as actually a lot of different deficits and causes. But so sometimes difficulty thinking of the words can be language related, some actually retrieving the word itself, and sometimes it can be difficulty with keeping that mental focus in the moment to stay on track with the topic and generate how you want to say what you say. Research does support the role of the cerebellum in language function. We know that it's not uncommon for word finding to be impacted, and there are exercises that can be helpful to help with increasing that overall efficiency of word finding. You don't forget any of the words that you've ever known. just becomes more challenging to access them right in that moment. So the exercises that you do gives the brain a chance to be in the position to need to access words, basically, and make that process more efficient again. So what I've included here are a list of different tablet apps that target word finding. Some of them, in fact, quite a few of them are games. They're apps that we have found, colleagues and I have found to really target word finding very well. Most of them are free. The only ones that have a cost are the ones that have the dollar sign beside them, Constant Therapy and the language therapy. I highly, highly, highly recommend looking into any of the free exercises first. If you find them to be very challenging, then maybe consider going to some of the paid services instead. And then also, non-technology based things like crosswords. If you enjoy doing crosswords, those are good word finding exercise. There are some board games like Taboo and Boggle, Scrabble that all exercise that function as well. And in general, if you are having difficulty finding a word in conversation and you give yourself a second or two, it's just not coming, it's on the tip of your tongue, it's just not there. Talk about the word, so describe what you're talking about. I joke, but it's not really a joke, that by about 5:30 in the evening, for whatever reason, I cannot access the word remote control when I'm trying to speak. And so when I'm talking with my husband in the evening, I seldom can articulate, hey, hand me the remote. So I end up, hey, can you hand me the box, I need to turn the volume up, right? I never said the word remote control, but he knew exactly what I meant because I described what I was going to do with it and what I wanted to do. It's a box and I want to turn the volume up, and I gestured how I would use that remote control. So gestures and pointing can be very helpful as well. Talking with your hands is actually very helpful for communication, and I highly recommend it. Okay, so moving on to talking about swallowing impairments. I've had the opportunity to talk about swallowing with this group in the past, which has been wonderful, and I'm glad to be able to touch base on it again today. I will try to move through this pretty quickly to get to more of the topics on cognition, and certainly we'll leave time at the end to answer any questions. But just in general, when you think about swallowing, there are 3 stages. There's the oral phase, which is food or liquid going into our mouth, and we need to chew it and get it ready to swallow. There's the pharyngeal phase, which the pharynx is the medical term for the throat. The pharyngeal phase is the food or the liquid moving from our mouth down to where the esophagus, the food tube, starts. And then the esophageal phase is the food or the liquid moving through our esophagus, which starts, the top of it is in our throat, and it ends at our stomach. When it comes, dysphagia is the medical term for difficulty with swallowing. And oral dysphagia specifically, so food and liquid in the mouth, chewing, getting it ready and prepared to swallow, and getting the swallow started. Oral dysphagia is a common impairment for people with spinocerebellar ataxia. So difficulty with chewing, difficulty keeping food or liquid in the mouth before you're ready to swallow, which can lead to some drooling or some dribbling out of one side of the mouth or the other. And occasionally food or liquid getting into the throat even before you're ready to swallow, and that can lead to coughing. There was an article in 2015 that summarized the incidence of dysphagia and some of the different types of ataxia. So just to give you an idea of the prevalence of swallowing difficulty based on the SCA subtype, but really the nature and severity of swallowing impairments within people with ataxia is still largely unknown. So oral phase, like we talked about, is getting ready to swallow. So for individuals who have ataxia, they may have difficulty with chewing, which can lead to an increased risk of choking if the pieces that then we're trying to swallow are too large. And certainly if they're too large and going down the wrong pipe, and blocking off the airway, making it difficult to breathe. So increased risk of choking. Someone may have difficulty keeping the food or the liquid in their mouth until they're ready to swallow. So even tiny bits, like tiny particles of food or a tiny drop of liquid that gets into our throat before we're ready to swallow is already heading on down the pipe because of gravity. And in our throat, there's one tube that heads to the stomach, and the other tube is our airway. So it's kind of a design flaw, I think, safety-wise, and how we're designed. So if we are not actively swallowing and something goes into our throat, gravity can very easily take it down the wrong pipe, so down the airway, instead of down toward the stomach, which can lead to coughing or choking. And then difficulty with gathering the food or the liquid to get ready to swallow, meaning food can get left behind in the cheeks after a swallow and somebody has to use their tongue to clear it out, or if their tongue is too weak to use their finger to clear it out of the side of your cheek, or food or liquid can fall out of the mouth when they're chewing, or if you lay down and there's still some food or liquid left in your mouth that wasn't cleared out with the swallow, then when you lay down, gravity can take that into your throat and cause difficulty. The pharyngeal phase for people with ataxia, they may notice food or liquid feeling like it's going up their nose during a swallow, going up into the sinuses, which may make your eyes water or make you sneeze. Food or liquid going down the wrong pipe, as I talked about. If it peaks down the wrong pipe, which is the airway, if it peaks down the airway just a little bit, that's called penetration. So it's just penetrating into the airway, and someone might be able to clear their throat or cough and get it up and out of there. Aspiration is the term for the bolus, which I apologize, I meant to update that. Bolus means the food or the liquid that you're swallowing. So if whatever you're swallowing travels down the airway beyond the vocal cords, so if it gets past the vocal cords, now that's officially aspiration, means that food or liquid is in your lungs, and nothing's supposed to be in your lungs except for air. So we should start to cough and try to clear it up and out of our lungs. If not, if any material stays in the lungs, it can lead to bacteria growing. It can lead to pneumonia called aspiration pneumonia. And as I think that we all know, pneumonia is very treatable and can also be very serious if not treated, and ultimately can be fatal. The last issue that might happen in the pharyngeal phase is that there's a little muscle that sits at the top of the esophagus, and it's a little ring that stays closed so that acid and material can't come back up from the stomach. That muscle might not open completely during the swallow like it's supposed to, or it might not stay open long enough during the swallow to let everything through. So it can lead to feeling like something's kind of stuck right here after you swallow, food or pills. So I think the most common signs and symptoms of swallowing difficulty are coughing with meals or drinks, clearing our throat, certainly choking. But I also wanted to list some other symptoms to be aware of. Particularly if you do have a runny nose or watery eyes when you're eating or drinking, if you find that you sneeze when you eat or drink, or feel like you need to, any kind of respiratory infection or illness, the feeling of something being stuck in your throat after you eat or after you swallow, and difficulty swallowing pills can all be signs of dysphagia. So you should call your doctor if you experience any of the symptoms that were on the list that I just showed you on any kind of a regular basis. We all have something go down the wrong pipe every now and then, but if you asked me when the last time it happened to me was, I know that it has certainly happened to me. It's probably happened within the last year, but I couldn't tell you the last time. If it's happening once a day, even a couple times a week and on a regular basis, then you should reach out to your doctor. They can refer you to have a consultation with a speech therapist and or a swallowing x-ray to see what's going on and to make any recommendations for safety. And then there is a free tool. It's called the Eating Assessment Tool. It's a 10-question survey that you answer that can be helpful. I included the link here that can be helpful to kind of guide you toward, well, should I be maybe reaching out to see about somebody checking into my swallow? And the directions for scoring and everything are on that sheet. So I know that I mentioned earlier I would promise not to bring this up too much, but specifically when it comes to swallowing, one size is not fits all when it comes to exercises and when it comes to strategies. In fact, some strategies and maneuvers that we talk about may help one person swallow beautifully and may make someone else aspirate who wouldn't be doing so if they were not using that maneuver. So I highly recommend that you talk to a speech pathologist if any of these are new to you. In general, there are some things that we should all do for swallow safety. We should all be sitting upright when we're eating and drinking, as close to, if we're sitting in a chair, our body and our hips are at about a 90-degree angle. So we should be as close to that as we can be. Certainly, if we're in a reclining chair, it should be all the way as far up as the reclining chair can be positioned. We should take small bites. We should take small sips. We should take our time. Try not to talk when we're eating or become distracted, because all of those things can lead to basically the brain not being able to really focus on how the muscles are moving. And when you have difficulty with coordination, if you're distracted or going too quickly and the muscles can't keep up, then you're at a higher likelihood of something going down the wrong way on you and making you potentially cough or choke. It's a good idea to avoid straws for most people who have difficulty with swallowing, because we tend to take a much larger sip and we tend to drink a lot faster, and both of those things we just talked about are things we should avoid. But again, it's not the same across the board. I will say, kind of general rule, if you use a straw and it makes you cough, stop using the straw. If you use a straw and it doesn't make you cough, okay. However, that doesn't necessarily mean that there's not difficulty going on, because some people have a lack of sensation in their airway, so they can be aspirating food or liquid and the body has no indication of that happening until potentially they get sick, get a respiratory infection or pneumonia. So it's a surefire sign if you are coughing to stop doing it. If you're not coughing, you still want to be cautious. And like we talked about, talk to your friendly speech pathologist to get more information for what might be best for you. And then there are different modifications. I'm not going to go too far into this, except to say the more solid, the more dry and crunchy a solid food is, the harder it is for the muscles to manage. The softer something is, or certainly if it is pureed down like a pudding or an oatmeal, those are typically the easiest for the muscles to handle. They don't have to work quite as hard. So you may consider, if there are certain textures that always give you difficulty, then avoiding those textures would help with safety. And then for liquids, there are various levels of thickening liquids. This is something that should be prescribed by a doctor or by a speech pathologist, but just so that you know, there is availability out there. If it's, you know, foods go fine, but my drinks, my water, my coffee are always making me cough, that sometimes by making those drinks thicker, it slows down how quickly that liquid moves, and it gives time for the liquid to go the correct way and for the muscles to do what they need to do. And for swallowing, I mean, depending on, it's hard to give a list of exercises that would be good for across the board, but the Masako technique is something that does partially target coordinating a swallow, and it certainly doesn't hurt, even if you do not need it. So this is something that if you feel like you have trouble swallowing, you might go ahead and try. So it is holding your tongue between your teeth while you swallow. So I will demonstrate this one, and it is hard, and you can't give up on it. I've been doing this for about 17 years, so I have practice with this. It may take a while before you're able to initiate a swallow, but tongue between the teeth and swallow. So notice I never let go of my tongue until after I was done swallowing. And then chin tuck with resistance is, it's like doing an abdominal crunch, but for your neck muscles. So you use a squishy ball, or you can use your fist if you like, tennis ball, whatever. You put your fist between your chin and your chest, and then you squeeze your chin down just until you feel these muscles in the front of your throat contract. And then you relax back to normal head position, and then again, and so on. You should not feel strain on the back of your neck or in your shoulders. If that's happening, then you're not exercising the right muscles and you need to stop. And then the exercises that I showed you for the lip and the tongue back in slide 7, those are also appropriate if you have difficulty with chewing, managing food or liquid in your mouth, any drooling or dribbling. Those lip and tongue exercises would be a good option for swallowing as well. Okay, and last but not least, we're going to talk a little bit about cognition. I'm going to be brief here. This is a topic that really quite a bit goes into. So I just want to touch on some of the more common things, more common difficulties that people might have, and some of the kind of easily accessible ways that we can do exercise at home for them. So cognition is the mental process of thinking, right? So getting information, processing it, storing it, remembering it, using it. And generally in speech therapy, we break it down into the domains of memory, attention, problem solving, and reasoning. And then executive function. Executive function is the term for basically the mother of all thinking skills. Executive function is our brain taking all of those individual components of memory and attention to make a plan, organize the information that we have for that plan, execute our plan, and monitor along the way. How is this going? Do I need to change how I'm approaching this? Am I getting the outcome that I want, etc. We use executive function for everything, brushing our teeth to filing our taxes and everything in between. So ataxia can impact cognitive skills. This was first identified back in 1998 and called cerebellar cognitive affective syndrome. And researchers were noticing difficulty with planning, flexible thinking, abstract reasoning, short-term memory, and some visual spatial skills in individuals with ataxia. And now, of course, we also know that cerebellar function contributes to not only thinking skills, but also language, and more over the years, more evidence is coming out to look at all of those skills. This is just a summary from an article that looked at the nature of cognitive decline based on the type of spinocerebellar ataxia the person had. It was a very small group that was researched, but really interesting to see some of the results. They did the same battery of tests 7.5 years apart. So the individuals tested with SCA1, all of the individuals tested showed a decline in the testing after that 7.5 years. SCA1 and SCA3 have the highest incidence of decline. And again, it was a very small subset, but more research would definitely be beneficial in that area. So how can you get a good cognitive workout at home? We know it's important that we need to keep our brain active. That's not news. A variety of activities is really important to keep our brain engaged. If we get bored with something, we tend to lose focus. And there are both low and high tech options out there for cognitive exercises that we're going to talk a little bit about. So if you want to work on your memory, short-term memory especially, so that's, short-term memory, it's a big topic, but basically it could be anywhere from, like I just heard it, just saw it, just did it, to maybe like a week, 2 weeks, right? Versus long-term memory is, who was your kindergarten teacher and what was the color of your first car, etc. Those things happen in different parts of the brain and tend to be affected very differently. Generally speaking, long-term memory stays pretty intact. Short-term memory is, generally speaking, what's going to be impacted for most of us. So ways to address memory at home are basically, it's just all different ways to put your brain in the position to need to remember something new every day. So you could read and summarize a news article, read the news article, and then touch base with a family member about it later in the day. Read this really interesting article. Try to remember, the most salient, important pieces from that article to be able to talk about it. Same thing, you could do that with a television show or a news segment. You could try using an association strategy to remember a new name every day. So this person's name is Susan, and oh, I have a niece named Susan, and they have the same color hair, and associating this new person with someone that you already know to make it easier to remember that person. When you're getting the grocery list together, you 100% should always make a grocery list. I would never say otherwise, but one good memory exercise would be, once the list is made, maybe challenge yourself to remember a few of the things that are on the list, to get those first when you get to the store, and then refer back to the list to make sure that you got all of those items and to complete the rest of your shopping. You can use mnemonics, right? Using the first letter of each word that you want to remember to try to spell a word. You can try to visualize if it's a grocery trip. I'm going to go get my fruit and try to remember all of the produce that I want to get without my list. Visualize yourself in the section you're going to. Visualize yourself grabbing the apples out of the specific bin that you always get your apples out of. There are some really good tablet apps, which are listed here, which work on memory. Again, $ is there's a cost, so the others are free. Elevate, I don't work for the company. I do have Elevate on my own phone. I really, really highly recommend that app. It's a brain trainer, much like Lumosity. You do a 5-minute pre-test, and then the computer program chooses exercises that are appropriate based on what was challenging for you on the pre-test. But it's great because it's 3 exercises are available each day that you sign in. You have access to those 3 for 24 hours. You can do them as much as you want. It will give you a reminder if you haven't signed in enough for the week, which was helpful for me to make sure I got my exercises in, and then it automatically adjusts the level of difficulty based on how you're doing, which is great. And it shows you a graph over time for each exercise of how your scores have been trending. I put the information for an activity book there that's memory exercising using a deck of cards, and there are several exercises in there. I use this in my therapy, and I did double check, it is still available on that website. And then some recommended reading. Now this is just, I found it fascinating, and I thought it was a really nice representation of no one has a perfect memory, and we can all find some strategy, some way to approach things to make it easier to remember them. So it's called Moonwalking with Einstein. It's about a journalist who found out about those wild memory competitions that happen where people memorize like 2 decks of cards that they only get to see each card one time, and then they can list all of the decks of the 2 decks in order from start to finish. It's amazing. But so he studies these folks, and then in studying it, he decides to try himself. And so that's the story of his journey. I was fascinated by this book. And there is also a TED Talk. The author does a TED Talk about it. He does talk about some strategies that can be used. I just think it's great. And then talking about strategies. Not everyone's memory is perfect. We all need to find the parts of our memory that are not as strong and try to find a way to compensate for that. I have to keep lists and set alarms because I have the best intentions, but I'm not very good at remembering to do something. I tend to get distracted right before it needs to be done. So I know that about myself and can manage it with strategies. So using your calendar, it doesn't matter if it's on a wall, in your phone, whatever you prefer and are comfortable with and will use, that's the direction you should go. You should make a to-do list every day. Yes, even of the things that you assume, I do that every day. Write those down as well, because when we get busy, those are the things that a lot of times we overlook. Using alarms to remind you of taking your medications, keeping things in a specific place, dedicated place, and being really diligent about keeping them in that spot, always having your purse hanging on the same hook or your keys in the same drawer, what have you, because the more organized your space and routine are, the more likely you are to remember. These are some tools for medication management if you have difficulty remembering when to take your medications. And for those of you who may not have in-home support, these are some really nice options. Again, I don't endorse any company. I will say the Philips medication dispensing service, I actually did get that machine for a family member of mine, and it was invaluable. I highly recommend it. And now there are lots of services. Amazon will prepackage your medications for you working through a pharmacy. And so you just get like stamps used to come on a roll in the container. It's a roll of these pre-filled packets of your medication, and you just have to double check the date and time to take that dose. So there's a lot of great tools out there. Searching for these things will also show you some others in an internet search. Attention skills. Attention, there's a lot to be said about attention. Attention is focus and paying attention to something long enough to get it done. But attention is also mental multitasking. It's being able to divide our attention between 2 different thoughts or 2 different activities at one time. It's being able to bounce back and forth. I'm doing the laundry and I'm cooking dinner and I'm answering my child's question and I'm doing this, and we're not simultaneously doing it, but bam, 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 jumping between these tasks. All of those are attention skills. So I have some attention exercises here for you. One of which, if you want to work on flexible thinking, are these mental manipulation sentences. So I have an example here, but you come up with a sentence. I recommend starting with 3-word sentences and building up from there. You have someone say the sentence to you. You don't do it by looking at the sentence because that takes the real challenge out of it. But someone would say to you, John likes black coffee. And you would repeat, John likes black coffee, so that you know which sentence you're doing. Then they'll say, okay, put that in alphabetical order. And you'll think about it and you'll say, black coffee, John likes. Same words, but in alphabetical order. Then you say, okay, well, give me the sentence in reverse. So John likes black coffee in reverse would be coffee, black, likes, John. Or you can put the words in order from the shortest word up to the longest word, counting the number of letters. So John only has 4 letters, then black and likes both have 5, so I went alphabetically for those, and then coffee is the longest at 6. That is way harder than it sounds, especially when you're not looking at the words. Again, there's some great apps for attention exercises. Elevates around again. That's a brain trainer, so it's got problem solving and memory and attention exercises all as part of the program. Logic Games is a great app for deductive reasoning. If you like mental puzzles, that's a really, really good one. And then again, the same series of books has a book of card exercises for attention. Again, strategies, crucial. You should eliminate distractions during important conversations. You should organize your home and personal space as much as possible. And once you organize it, be diligent about keeping things where you've decided that they should go. Make a plan for the day, make a plan for the hour, make a plan for this specific task before you start, and stick to the plan. And then after you finish what you're doing, ask yourself, how did that go? Would I change anything for next time? So you're reviewing after it's done, so you're not interrupting yourself and having to like try to switch gears a ton of times or change directions in what you're doing. Unless you do notice, hey, I'm in the middle of, cooking dinner and I'm about to do something super unsafe, then absolutely you should stop then and change path. But otherwise, let yourself complete your plan and then decide, how did it go? What would I do differently later? Know your strengths, know your weaknesses, and adjust accordingly. No one is perfect. And in real life, you just got to get through your day. So you got to adjust and know, if you are not a morning person, don't try to do really complicated things in the morning. You're not setting yourself up for success. Do it during a better time of day or time and around medications, things like that. And it is very important to take mental breaks. There is a slide coming up in a little bit that'll give you a little bit more direction, but basically it is good to challenge ourselves. We shouldn't be too laid back. We need to challenge our brain to get exercise, right? We don't want to be cognitively lazy, if you will, but we also shouldn't push ourselves so hard that suddenly now I've got such a headache and I'm out of commission for a day because I way overdid it the day before. So you got to find that balance. Breaks are important. That doesn't mean sleeping, but certainly getting to a quiet place, not having the television on, not looking at a phone, just quiet. Maybe it's on the porch listening to the birds, whatever the case may be, not in a conversation. 5 or 10 minutes, your brain needs that to kind of key down and recharge. All right, so executive function is the last area of cognition that we're going to talk about, and then we're going to have time for questions. So executive function, like I said, that's the mother of all skills, right? Planning and organizing and figuring out how we're going to do whatever it is we're going to do. Deductive reasoning puzzles are a great way to exercise this. The Logic Games app that I talked about is a great way to practice deductive reasoning. Think about, can I do this on the fly? I think a lot of us have done these in the past. Susie is twice as old as Jim, but half as old as Bob, and Bob has a green house, and Jim likes cats. What color is each person's house? What kind of pets do they have? And how old are they? So those types of puzzles are deductive reasoning puzzles. Great cognitive exercise. Comparing and contrasting things. Think about two things that would be in the same category together. So for example, $1.25, they're both money, right? So if I think about comparing and contrasting, how are they the same? They're both money, so I can spend them, I can get them at a bank, I can keep them in a piggy bank at home, I might find them in my wallet, all of these things that they have in common. They have a number on them, they have a face on them. And then $1 versus a quarter, if I'm going to contrast them, well, how are they different? One's a coin, one is paper. One's round, one's rectangular. One might rust and get sticky in the coin cup in my car, and the other one might get all bent and creased in my wallet. So thinking about how they differ from one another is that concept of having to organize information in our brain and a little bit of flexible thinking as well. Being the point person for planning and scheduling appointments, if it's safe and effective for you to be able to do that, even if it's a little bit tough or somebody has to look over it maybe, being the point person for that is good cognitive exercise. Again, coming back to making lists, being organized, and there are a ton of different activity books and games and all sorts of things that we can do to challenge. You want to try to find something that is challenging, so it shouldn't feel easy. You don't have to love it. Sometimes it's the things that we don't like very much that are the best challenge for us, but it should be something that you at least are enough engaged with to do it on a daily basis as a little bit of practice. And if it gets too easy, if you still want to do that for fun, that's cool, but don't count that as exercise for the day. That's just fun. And always make a plan. The slide says it well, but just always have a plan, whether you are brushing your teeth or making dinner or driving somewhere, it doesn't matter. You should stop for a moment right before you start and have a plan. What am I about to do here? Do I have the tools that I need to do it or the supplies that I need to do it? Do I have the time that I need to do this appropriately? Make that plan. It'll save you a ton of time from having to backtrack and fix mistakes. And it'll save you a ton of frustration. Okay, so this was the tool that I mentioned earlier. This is the cognitive pacing scale. I got this from a colleague who went to a conference at National Rehab Hospital. So basically, I like this because it's a little bit of a recipe. You find how you're feeling in the middle column. Based on how you're feeling, the column on the right tells you what you should do about that. So for example, if I'm thankful for what I have and I'm happy to be alive, or I'm just feeling good in the moment, right? I just keep doing what I'm doing. Things are fine. But if I'm down, you know, I feel tired, I really want to sit down or lay down, I'm feeling pretty, you know, I'm not very patient right now, I'm kind of snappy. Well, then it's time for me to take, you know, a 10-minute break, maybe up to an hour to rest. Again, that doesn't have to be sleep, and it shouldn't be more than an hour. And then after that hour, try again and reassess how you're feeling and go from there. This is a really nice tool because sometimes, I mean, a lot of us, I use this because we'll kind of get into that cycle of I want to push myself, I want to do more, you know, I want to get the benefit out of this, but then I don't want to do too much and I don't know what it means to not overdo it or not underdo it. So this is a nice touch point. And then the next slide is a list of ways to try to avoid mental fatigue, that mental fog that can set in. It's some nice tips and reminders. So thank you very much for your time and bearing with me while I feel like I zoomed through that. I really wanted to make sure to get that information out in time to give questions or to answer some questions. So thank you for bearing with me so far. There were a few questions that were submitted ahead of time. I think I already touched on the question about Medicare and telehealth. There was another question about whether or not LSVT, which is the Lee-Silverman voice treatment, can be effective for ataxia, and it absolutely can. There's actually at least one case study that I know of now that specifically addresses the use of LSVT for someone with ataxia. But the concept of LSVT, all of the exercise and the program that goes into it, it completely focuses on being loud, slowing down, pausing, that slop technique that we were talking about earlier for clear speech. So it's a wonderful, wonderful tool. And LSVT is actually something, I am certified in LSVT. That is something that could easily be done over telehealth. And if you decide to go the LSVT route, they have a website. It's lsvtglobal.com. And you can find providers in your area and some tools. And they do have an at-home version. I would personally still recommend at least consulting with a speech pathologist before doing that, but there is also a dedicated at-home version. And someone asked, how do you prevent biting your tongue or the side of your mouth while you're eating? Strengthening your mouth muscles only increases the power of the bite, which is an excellent point. I mean, the honest answer is, I don't think that you can completely prevent biting your tongue or the side of your mouth. There are some things that you can try to do to lessen it. Number one, taking your time and limiting distractions during meals so you can really focus on how you are chewing can help to give the muscles better control to keep them from biting a structure that they're not supposed to. Also, if you find that it typically happens on one side of the mouth versus the other, making a concerted effort to put food onto the stronger side, the side that you're not biting, and try to keep it on that side of your mouth while you're chewing may be very helpful. But otherwise, I sadly don't have a real great trick or exercise to be able to avoid that. So I think those were the only pre-submitted questions. Are there any other questions that folks have?
We do have some more questions for you,
All right.
Amanda. So our next question, this attendee is wondering about swallowing. They sometimes wake up choking from saliva lying on their back. So any suggestions that you may have other than lying on her side?
Elevating the head of your bed may be very helpful. So there are wedge-shaped pillows that you can buy specifically for that. I know when I was growing up, I had a family, my sister had asthma, and so she was able to find at the pharmacy a wedge-shaped pillow that went under then her regular pillows, and it elevates the whole upper part of your body. Using just more pillows under your head and neck doesn't help, because all that tends to do is jam your chin down to your chest. And what you're really trying to do is elevate your chest so that if gravity is bringing saliva down your throat while you sleep, that you're directing it toward the esophagus to go to the stomach instead of the airway. Some people also put the head of their bed up on risers. You can buy risers at, like, department store. I have heard of people using books that didn't have risers. That makes me a little nervous. But I have been told that folks have done that. But so anything to elevate, just like if you looked up precautions for acid reflux, kind of similar precautions, because you're trying to direct the fluid the way that you want it to go versus down your airway. It just happens to be saliva instead of stomach fluid.
All right, and our next question, this person says when they talk, it sounds to others as if their throat is sore. Does that have something to do with the ataxia?
It absolutely can, yes. So our vocal cords, if they are not moving smoothly, not moving in a coordinated fashion, not moving evenly, it can change the sound of our voice. For example, if I just make an ah sound, for my normal voice is ah, but if my vocal cords aren't moving the way that they should be, ah, that's more of a strained sound. Like I said, I'm not specifically a voice expert, so I will do my best with these demonstrations, but there's also kind of like if we're not using enough volume when we speak, if we're not loud enough, our voice will sound kind of gravelly, like a little, almost like bacon frying in a pan, and it is called a glottal fry. So if you notice that your voice is sounding like that, or others are telling you, try getting a little bit louder and try elevating your pitch. So if my normal speaking pitch is about right here, I might bring it up to right here. And sometimes just elevating your pitch is enough to make the muscles move more smoothly and it'll be a clearer sound. If those things don't work, then you also may want to see an ear, nose, and throat doctor, because they can look with a camera, they can look at the vocal cords and just make sure that they are moving okay, that there aren't any like nodules or lesions on the vocal cords, because it could have to do with ataxia, but it may be something completely different that would have a different prescription way of going about making it better.
Great advice. We have an attendee that would like you to speak more on auditory comprehension.
Sure. So auditory comprehension is understanding what we hear. Very basic auditory comprehension can be as basic as, I show you two pictures and you point to the picture, this is a picture of an apple and this is a house, point to the house. That's very basic auditory comprehension, all the way up to being able to hear a story, watch a movie, and be able to comprehend the plot and discuss, the finer features of what we're listening to. So that's auditory comprehension. That's something that's easily tested by a speech pathologist. And if then there are exercises to be able to make it easier. If you do have difficulty with auditory comprehension, in general, it's good to let people, just ask people to repeat what they asked you. If it's really crucial information, ask for someone to write it down for you so that you can see it as well, because then you're bringing that visual comprehension in, that reading comprehension, and you're not solely relying on what you hear. And then you have it written down for later too. So especially like doctor's appointments and medical information, it's good to help to understand and process that by having it written down so you can read it.
Great advice. Any of the apps geared more towards kids that you had mentioned?
Are they geared more toward kids? Some of the games might be, but to be honest, I think I would feel safe in saying adolescents. I would say anybody maybe 13 and older should be able to do those. Little kids, no. I work with adults, and so my recommendation, my tools are really geared toward maybe adolescents, but more so adults.
All right, and we have a couple of comments about straws. You had mentioned getting rid of the straws. So one person, how do you drink with no straws when you shake with ataxia?
That's a great question. There are, in the field of occupational therapy, if drinking with a straw makes you cough, then I would get rid of the straw. And if tremors make it difficulty to drink from the cup, occupational therapy can help. There are weighted cups that sometimes are helpful, or wrist weights can be helpful off the top of my head. That is not my area of expertise, so I'm not recommending that, but an OT would be able to point you in the right direction there. Also a cup that has like a travel cup that has a lid on it, so that if you are shaking, that nothing's going to spill, but it still allows you to drink from the brim of a cup versus through a straw would be a good option.
Sounds good. Those might be good options for this other question about the straws. Without the straw, they tend to inhale air. Without, they tend to inhale air, waiting for the liquid to hit their mouth and choke. Any suggestions on losing the straw? Maybe some of those.
Sure. Try sip from the cup, keeping your lips, like once you take that sip, keep your lips closed and hold your sip in your mouth. So now I'm about to use a straw to do it, so I apologize. But so when you take your sip, keep it in your mouth for a second or two until you're really thinking and focusing on the swallow and you feel like you do have good control, and then swallow. That may help.
And this attendee was told by a speech therapist that coffee stirrers might be a good alternative for a straw because they're smaller. Any thoughts on that?
I've never tried that. I can definitely see the logic behind it, so I'm not going to say heavens no. I've never tried it myself. You would have to have really good lip strength and mouth strength to be able to create the suction that you need, because the smaller the straw is, the more of a suction force that you need to actually get the liquid through. So if you have weakness, that might be challenging, but maybe. Again, I default to, if you're a person who coughs a ton when you're using a straw, then try the coffee stirrer. And if you don't cough using that, that's a pretty good indication that it's a better way to go. Yeah.
Sounds good. And this attendee is wondering about cognition testing and assessment. They thought that this was done by a neurologist. Is it not, or how does one embark on that?
So it certainly can be. There is a subset of psychology called neuropsychology. And so that's not really like talk therapy psychology, which I think is the more traditional definition that most of us know, but neuropsychologists are psychologists who specifically study the brain, all of the different parts of the brain and what they control, and then cognitive outcomes that can come from any kind of disease or damage to the brain. And they can certainly make recommendations. Typically speaking, their test batteries are much longer. It might be like a 4 to 6 hour test, and they really delve into detail with memory and language skills, etc. So you can get a really nice profile of strengths and weaknesses, and then they can help to guide you with, oh, I think that some cognitive therapy with speech therapy may be helpful, or I don't think you need therapy. I think, working toward using these strategies and goals at home would be helpful. So neuropsychology is a great way to go. You don't have to see a neuropsychologist, though. Many people, if you already feel like you have a good idea or a good handle on the kind of thinking skills that you're having difficulty with, you can go directly to the speech therapist because generally our assessment is going to be about an hour, and then jumping into the exercises for follow-up afterward. Neuropsychology may follow up. It's usually less frequently than a speech pathologist would follow up with specific exercises. They can really help with, though, if you're trying to return to work or if you need some accommodations at work. Neuropsychology is a great avenue because they can help to inform, you know, maybe it's a shorter shift or, you know, adjusting a schedule or accommodations as far as the environment itself. They can make those written recommendations, much like a physician could. Versus speech therapy, we can certainly do that, but it may not carry as much weight with human resources or with work. So,
yeah, those recommendations for accommodations are very helpful.
Yeah,
that's great information to have. This person is wondering about frequency of visits to a speech therapist. They have a lot of the exercises that were provided here today, and they do see a speech therapist regularly. Should they see a speech therapist regularly or just when symptoms decline?
I would say when you're noticing symptoms, because the other side of the coin is for speech and for cognition. You may be having difficulty and you're already compensating well for it. And even though you notice that the difficulty is there, or family is noticing that the trouble is there, your day-to-day life isn't being impacted by it. You're not making any, you know, errors that are leading to safety issues, falls, cooking error, you know, forgetting to leave the stove on, things like that. If those things aren't happening, there have been no issues with driving. You know, you're not getting any kind of negative feedback from work. If you feel like, yeah, I have these strategies and I'm still not 100% me, but I'm doing okay, then maybe you don't need the intervention right in that moment because you feel like life is going pretty smoothly, all things considered. But if you feel like there's an impact on your day-to-day life, your day-to-day routine, your independence, your work, your safety, then I do recommend anytime you notice those kinds of symptoms, reach out to speech therapy. You know, occupational therapy also works with cognitive skills, specifically as relates to driving and cooking and those activities of daily living. So occupational therapy can be a great resource as well. And generally speaking, outpatient therapy is usually 2 to 3 times a week. It's different across the board, but generally speaking, about 2 to 3 times a week.
All right, so this will be our last question for today. I think it's an important question to address. This attendee wants to know if we're choking and no one's around for us to help us, how can we best dislodge food from our throat and be able to breathe again? Obviously, this is a desperate medical situation, and it's understood that we only proceed to dislodge by ourselves out of desperation.
Right.
Also, is it ever advisable to pushing the stuck food further, or is it only advised to dislodge out of the throat through the mouth?
Yeah, only out, because if you're trying to push it down further, just anatomically speaking, if it's already in your airway and you try to push it further, it's just going further into your lungs. And if you ever look at a diagram of the lungs, the breathing tube, the trachea that comes in, it goes into branches. That tube gets smaller and smaller and smaller the further it goes down into your lungs. So pushing that item down is just pushing it into a smaller space. So you never want to force anything in. If you are fully choking, cannot breathe, cannot cough, and no one's around, you can give yourself the Heimlich using the back of a chair. And I know there are also ways to do it if you are in a wheelchair and not able to stand and use the back of a chair. There are ways to do it seated. And the Red Cross, I believe, has videos on their website about how to administer the traditional Heimlich maneuver to someone else, how to give yourself the Heimlich using the back of a chair or a hard surface, and how to do so seated. So I would recommend looking at the Red Cross website.
That's such important advice, and thank you so much for those resources that you shared on that issue and the variety of topics that you covered today. And that is all we have time for today. I'd like to thank our attendees for joining us, and wanted to remind all of our attendees that a recording of today's webinar will be made available, and we hope you all take care and stay safe out there. Bye,
Stay
everyone.
safe.